Hi, my name is Jody Marin Barth. I'm a physical therapist from the Center for Facial Recovery, and I would like to empower you with knowledge about facial palsy. If you or a loved one has or had Ramsay-Hunt syndrome, RHS, here are the things you need to know. The Center for Facial Recovery is a comprehensive physical therapy practice located in the greater Washington, D.C. region. Our physical therapists are some of the few in the country that specialize in the treatment of facial palsy, with specializing in treatment of Ramsay-Hunt syndrome, RHS. The cardinal signs of facial palsy are unilateral facial weakness or paralysis. This only occurs 1% on both sides of the face. Dry mouth and or eye, problem with taste, sudden onset over 24 to 48 hours. Several hours before the onset of facial weakness, many people experience severe pain behind the ear or in the back of the head. Peripheral nerve palsy involves all the branches of the facial nerve. In the USA, it is reported that there are 40,000 new cases per year, which comes down to 3,333 per month, 769 per week, 109 per day, and 4 per hour. But what is happening, as you all know, there's not enough information out there or not enough clinicians with the proper information to treat patients with facial palsy. The distribution of new cases of acute peripheral facial palsy are as follows. 15% have Ramsay-Hunt syndrome. This is from the herpes zoster reactivation with hallmark vesicular rash of shingles infection occurring in the ear canal, auricle, or mouth. So these are like chicken pox types of breakouts that are noticed. 25% have zoster synherpeti, or known as ZSH. This is from the herpes zoster reactivation, but without the hallmark rash, meaning without the pox marks. Zoster synherpeti patients experience the same pain and weakness along the distribution of the facial nerve without visible signs of eruptions. Like typical herpes zoster shingles, patients have preceded by dysesthesias, meaning pain behind the ear, headaches, pain in the back of the head. In 57% of patients who present with peripheral nerve palsy, they have herpes simplex reactivation. This is from the herpes simplex 1 virus. This is the same virus that causes oral canker sores. These are patients that have the diagnosis of Bell's palsy. And 3% of patients that present with peripheral nerve palsy are patients that suffer from Lyme disease, which is transmitted most commonly by deer ticks to humans. What happens during the inflammation of the facial nerve from the virus? Well, the virus attacks the facial nerve up here in the brain stem. That causes swelling of the facial nerve. So the signal that goes from this point all the way to these different points along these 5 main branches of the facial nerve to all of the facial muscles is disconnected. So it's as if this light switch was no longer plugged in and the light bulb could not go on. Ramsay-Hunt syndrome, RHS, versus zoster synherpeti are two diagnoses that are very underutilized and misdiagnosed. Patients with both Ramsay-Hunt syndrome and zoster synherpeti present with a unilateral inability to close the eye, smile, wrinkle the forehead, and whistle. There's severe pain around the head, ear, or neck. Typically, what happens in patients with Ramsay-Hunt syndrome and zoster synherpeti is that this pain starts after the facial weakness. In patients with Bell's palsy, typically we have that pain description first, then facial palsy, and that pain goes away. With patients with Ramsay-Hunt syndrome and Zoster-Sinher-Petit, that pain becomes more severe after the facial weakness. There is loss of taste, unusual taste, such as a metallic taste, and or dryness in the mouth in both Ramsay-Hunt syndrome and Zoster-Sinher-Petit. Paralysis of the little muscle with inside your ear, the stapedius muscle, causes sensitivity to sound in both Ramsay-Hunt syndrome and Zoster-Sinher-Petit. This gives you a hypersensitivity to sound, or what is known as hyperacusis. Small red or white bumps appear on the tongue. These swollen bumps may cause some pain and discomfort and do occur in both Ramsay-Hunt syndrome and Zoster-Sinher-Petit. Painful herpes-type skin eruptions on the pinna of the ear, as noted here and here, only occur in Ramsay-Hunt syndrome. These same small, painful blisters can also occur within the mouth area. This also only occurs in Ramsay-Hunt syndrome. Vestibulocochlear disturbance, meaning a problem with balance and or hearing, can occur in both Ramsay-Hunt syndrome and Zoster-Sinher-Petit, as well as vertigo or dizziness. Patients with Ramsay-Hunt syndrome, though, have much more of a severe case of vertigo than patients with Zoster-Sinher-Petit. While the traditional management of acute peripheral facial palsy has been a 10-day course of steroids and a 7-day course of antivirals by physicians and clinicians saying just to wait and watch, the large studies on this condition have demonstrated that more than 25% of the patients have incomplete recovery with long-lasting effects of chronic facial deformity and dysfunction. It is those patients that are diagnosed with Ramsay-Hunt and Zoster-Sinher-Petit are the ones that suffer from this incomplete recovery. Due to the vast majority of acute peripheral facial palsy patients regaining full recovery and the lack of definitive diagnosis of the etiology in each case, there has yet to be established a paradigm for identification and treatment for patients who may not fully recover. However, it has been shown that irreversible nerve damage is likely to occur within 3 weeks of the onset of the condition, and earlier recovery of function portends a much better prognosis for patients with this condition. Ask your doctor about the following recommendations. This protocol is based on successful clinical outcomes and research. If your provider is not familiar with the treatment of facial palsy, specifically with Ramsay-Hunt syndrome, contact us and we will connect you with one of our providers. We can be contacted at info@facialrecovery.com. Steroids are recommended anti-inflammatory treatment to minimize swelling around the nerve that's causing that disruption of the nerve signal. High-dose steroid taper for 3 weeks total is what is recommended. This is consistent with what is known about irreversible nerve damage beginning as early as 3 weeks after nerve injury, and is consistent with the established dosing regimen for sudden sensorineural hearing loss, which is the most similar sudden disease similar to Ramsay-Hunt syndrome that is from the cranial nerve system, or those nerves that are in the brainstem area. Typically what happens if you're placed on a 7 to 10-day course of steroids, your symptoms are decreasing, your pain is decreasing. And then as soon as you stop the steroids, all of a sudden you start experiencing severe pain. And for those reasons, it is why we are recommending this high-dose steroid taper for 3 weeks. The other recommendation is use of calcium channel blockers that help to optimize nerve recovery and propagation of the nerve signal along the damaged facial nerve. It is recommended to use nimodipine at 60 milligrams 4 times a day. Based on prior studies of duration, we'll continue this for approximately 12 weeks from the date of onset of paralysis. Antiviral treatment is needed to maximize the suppression of the reactivation of either the herpes simplex or herpes zoster virus. In the cases of the herpes zoster virus patients, so those patients that are presenting with more severe symptoms, a 3-month course should be considered. And these are the 3 different types of antivirals that are recommended: acyclovir, valcyclovir, and famciclovir. Famciclovir has been found to show better usage in acute facial palsy. When to start treatment for facial palsy? That's always a question. The answer is now. Advantages of early intervention is it's important to be educated in eye care and for you to understand the disease process. Starting a proper home program in eye closure exercises, gentle massage, and other exercises under the direction of facial palsy therapy specialists is imperative. Early intervention empowers you, the patient, and has been shown to provide a significant positive psychological effect instead of you being told, just sit and do nothing. There are ophthalmic concerns when it comes to facial palsy. There's drooping of the eyebrow, elevation or retraction of the upper eyelid, sagging and outward turning of the lower eyelid and eyelashes, watering, inability to close the eye, drying of the cornea, and abnormal drooping of the upper eyelid, which is called ptosis. What occurs is most of us have a Bell's reflex, and the Bell's reflex is when you close your eye, the eyeball moves up, and this is a defensive mechanism. It helps to protect the eye when something is coming towards the eye. What happens is in patients, though, with facial palsy, because there is a weakness of this upper eyelid, it has trouble going over the globe when the eyeball is rolling up. And that's when we get what's called the Bell's phenomenon. So for you who are suffering from facial palsy, you will feel that the eye is fully closing. However, if you take a video or somebody takes a picture of you, you will see that the eye is not closing, that the eyeball is rolling up, but the eyelid is not touching from top to bottom. One of the eye closure retraining exercises is by placing the finger underneath your eye. You're going to be looking down at the finger and then gently close both eyes. This helps to overcome that Bell's phenomenon. It brings the eye down, assists the eye closing, so that we can start promoting good eye closure. We recommend performing these exercises, doing 10 reps, holding the eye closed position for a count of 5, and repeating every hour. Good eye protection and hydration is crucial. Inability to blink and close your eye is painful, distracting, and could cause other muscles of the face to activate when they should not. Research has shown that the longer it takes the eye to close, the higher the chances for synkinesis, which is abnormal wiring of the facial muscles. It is recommended to use preservative-free eye drops every 2 to 3 hours for hydration. Just like with thirst, if the eye feels dry, it's already dehydrated. Indoor and outdoor eye protection is recommended until the eye can fully close. It is important to protect the cornea from airborne particles that can cause abrasions. These are just 2 examples of things that can help protect the eye: a moisture chamber and these tranquilize. The Dry Eye Shop, and their email is located down here, service at Dry Eye Shop. They are a very knowledgeable company, and they have multiple types of eye drops and lubricants that should be used. Eye drops are recommended to use every 2 to 3 hours, preservative-free eye drops, and eye gel is recommended to be used at night. Here are some other examples of eye lubricants and gels that you should try using. There is not one answer for everybody, so that's why I'm giving you several different types that are recommended. Eye Eco Company has several excellent eye protection devices. The Onyx is lightweight and comfortable to be used at night. What it does is it helps keep the moisture in so the eye doesn't dry out. You don't have to, and you should not tape your eye closed. If you take the tape and are constantly putting it along the eye, every time that you take the tape off, you're going to be pulling at your eyelashes. The eyelashes are innervated by the facial nerve, and they are also impacted. So, and eyelashes are used for protection of the eye. So every time you tape that eye closed, you have a risk of pulling on some of those eyelashes or disrupting them. The other risk that you have is scratching your cornea every time you're taking that tape off. So at night, it's not that the eye has to be closed, but the eye needs to be protected, and it needs to be protected and keep the moisture in so it stays lubricated. So the Onyx is one option that a lot of our patients like. The other one are these eye seals. They come in clear and they come in black as well. For our mothers that are nursing, the ones that are clear seem to work better because you have to get up in the middle of the night and then to have to take them off to go and nurse the baby. It seems easier to use the clear ones, but it's up to you which works better. They both are very comfortable to sleep in. These also work well, especially the one here with the nose, if you are using a CPAP. For use during the day, the moisture release eyewear provides relief from dryness and can be used for indoor and outdoors. And just note, I don't work for these companies. I don't get any payback from these companies, but we've done a lot of research, and based upon what our patients' feedback, these products seem to work very well. There's also this Ortolux eye bubble. So it's another form of moisture chamber. You can go on to the Dry Eye Shop and look at the video of how to put it on. And then there are these eye lock eyelid occlusions, which also the Dry Eye Shop has a video to show you how to apply that. Those are to be used at night for protection. So the bottom line is the eye needs to be lubricated during the day using drops at least every 2 to 3 hours, preservative-free drops. At night, a gel or a lubricant is recommended. At night, the eye should be protected so nothing can get in while you're sleeping. Things such as cotton material, like a sleep mask, should not be used because if the eye is not fully closing, that could cause damage to your cornea. Eye closure assistance we recommend in the beginning with use of an external eyelid weight, as shown here, and 3M micropore taping. So in that video, it showed the use of an external eyelid weight. Those external eyelid weights do come in different colored tones, and your physician can order them for you. They come in varying sizes, depending upon how much assistance you need to help close from that upper lid. The taping on the outside of the eye helps bring that lower lid up to make a tighter seal in the corner of your eye. Eye closure itself is 90% from the top lid and 10% from that lower lid. But that 10% is what gives you that tight eye closure. So by taping up from the bottom here makes a tighter seal in the corner, and then the eye weight helps to close. These are temporary treatments that we utilize as the facial nerve is recovering and as it gets stronger, so you can close your eye on its own. The longer it takes to get that eye to close, the higher the risk is for synkinesis. So that's why we recommend these techniques immediately. If within 10 to 12 weeks, the eye is still not closing and you're requiring the use of the weight and the taping, then a consultation with an oculoplastic surgeon is recommended to possibly do a couple of stitches in the corner of your eye to tighten up that area to help with eye closure, and possibly using filler in the upper eyelid. Physical therapy is highly recommended in the beginning to help optimize muscle mobility and minimize tissue contracture during the beginning periods of paralysis. Research has shown that physical therapy helps to maintain the pliability and elasticity of muscle tissue and facial soft tissue in order to prevent contracture and fibrosis that may occur from prolonged muscle inactivity while the nerve signal is interrupted. So if the nerve is not sending a signal to the muscle and the muscle is not able to contract, fluid sits in the area. That fluid thickens up, tightens up, and makes it harder for the muscle to start activating once the nerve and muscles reconnect. So keeping your tissue nice and loose in preparation of nerve recovery is very important. Massage is one way of doing that. Massage improves circulation of the blood from the friction formed between the skin and the fingers. Massage also improves movement of the lymphatic fluid, or the fluid that's found within our body, and minimizes swelling in the areas. A lot of you are probably suffering from what feels like swelling underneath your eye or in your cheek area, and that's because of lack of muscle activity. So massage will help to reduce some of that swelling in the area, once again, until your muscles start contracting. And this just shows you the directions of recommended massage techniques. You never want to be pulling on your eye. So when you're massaging downward from your forehead, downward in, up from, so that you're not pulling on the lower lid. Gentle massaging techniques using the fingertips of your fingers and just doing very small, round, circular techniques. Okay, and so it's a massage down, right? Massage down, massage down, massage up, massage in, and massage up. You're going to repeat this. You're going to do 10 strokes in each area and repeat that whole cycle 10 times. Lymphatic drainage of the eye and face. The lymph system is the fluid that's within the body. And the way the fluid moves within the body is through muscle contraction. So when we don't have muscle contraction, this fluid becomes stagnant. And that's what can also cause some thickening of tissue. So when you are massaging around the eye area, the lymphatic area, again, you're doing very gentle touches, and you're going to be massaging out and down, under and down, from the corner and down. And these are very gentle, very, very gentle, as if your face was an eggshell. This is a little different than the massaging that we talked about before. The massaging before was for blood circulation. This is for fluid. Okay. And so it's very, very gentle, eggshell-like strokes in this pattern. Once again, we recommend to repeat each area for 10 repetitions. Do not use electrical stimulation. Many of you probably are seeking acupuncture assistance with your symptoms, which is wonderful. It helps to increase circulation in the area. However, if the acupuncturist is wanting to use electrical stimulation, we highly recommend not to be using that through the needles. This article was done and did an extensive study to show whether or not electrical stimulation was beneficial for patients with acute or chronic facial palsy, and there was no evidence to support that electrical stimulation was beneficial at all. There have also been some studies that have shown the use of electrical stimulation could increase synkinesis, or that, again, abnormal innervation that can occur. And synkinesis is something, if you guys have been doing any research online, you'll see patients talking about when they go to smile, their eye closes, or when they pucker, their eye closes, or when their eye closes, your mouth moves. And we're trying to avoid that type of abnormal regeneration. Do not perform gross exercises, okay? Gross facial expression. Gross exercises are non-specific. They can recruit excessive and unnecessary motor units that produce expressions not characteristic of normal facial patterns. When we do exercises for the face, each area of the face has its own muscle that is responsible for its activity. So when we do exercises for the face, we are trying to promote only that muscle that is responsible for that area to activate. So for example, if we're trying to work on showing the upper teeth, the only muscles that we're trying to encourage to work are the muscles along the nose area here. That's a form of neuromuscular re-education, conservative approach to facial rehab. It restores symmetrical facial movement, reduces or eliminates associated speech and swallowing problems. Many of you are probably suffering with difficulty saying your P's, your B's, your F's, flubbing words. And that's because those are what we call labile sounds, meaning that the tongue needs to push against the lips to make a crisp sound. And when your lips are not strong enough, when there's weakness, that tongue can push through easily, and that'll give you kind of that flubbing inability to really pronounce crisp F's, P's, B's. Excuse me. Neuromuscular re-education helps to correct movement patterns. As I said, we're trying to avoid abnormal movement patterns and encourage the normal movement patterns of the smile working from the muscles that occur here, the pucker occurring from the muscles around the mouth, the snarl from the muscles along the nose, the eye closure from the muscles around the eye. And these are examples of specific facial movement exercises. Seeing a facial palsy therapist who specializes in treatment of facial palsy is highly recommended. Mirror book therapy is a technique that my partner, Jinsey Stezer, and I developed. And in mirror book therapy, you use a bifold mirror, and shows twice reflection of your unaffected side of your face. So when you look inside the mirror, you'll see your unaffected side of your face twice reflected. So this is the twice reflected side of the face. So the patient has actually left facial palsy, but she is looking in the mirror here and, oops, I'm so sorry. And is seeing twice reflected the right side of her face. And then what she will be doing is working on raising the eyebrows, wrinkling the nose, showing the upper teeth, smiling, puckering, and showing the lower teeth. These exercises are to be done slowly and not to exceed 15 minutes. We recommend you do 10 reps of each exercise, holding for 5 seconds. It is just a very, very gentle way of trying to get the connection between the brain and the muscles that have lost their innervation. So when you look in the mirror and you see that your face looks normal, then you're not going to try excessively hard to get your face to smile. You'll go through these exercises very gently, not forcing motion. Diagnostic ultrasound is an excellent imaging tool that practitioners can use to improve treatment regimens and outcomes. This is painless and it's reliable. It's a non-invasive tool that can be used to detect the return of muscle function or abnormal involuntary activity such as synkinesis prior to visualization. This is highly recommended instead of doing an EMG or an ENG. It helps us with great predictions as well as far as your recovery. These are just some of our patients that have suffered from Ramsay-Hunt syndrome to show you that there is a light at the end of the tunnel. Early intervention for Ramsay-Hunt syndrome is successful. I recommend, if you haven't gotten a copy of the book, Fix My Face, there are a lot of good exercises in there, as well as wonderful information from a team of physicians that range from ENTs, facial plastics, ocular plastics, as well as dentistry and acupuncture. It is available on Amazon. Thank you for your time. I wish you all a speedy recovery. Remember, be kind to yourself. Ramsay-Hunt syndrome is a severe virus that has attacked your facial nerve, but it has also attacked your body. So give yourself a lot of rest. Don't push yourself. When you feel up to it, beginning aerobic exercise is recommended because aerobic exercise increases the circulation of your body. But be kind to yourself, okay? Rest and take it easy. And please reach out to us if you have any questions or we could be of any assistance. God bless.